So I'm a colorectal surgeon. I did general surgery training first and then completed additional training in colorectal surgery. So I operate on the anus, the colon, and the rectum. Also do colonoscopy and treat hemorrhoids and help people with other things such as pelvic floor dysfunction. So it's that diversity of patient problems and the diversity of procedures we get to do that really drew me to colorectal surgery. I like talking to patients about things that are difficult for many people to talk about. I like to help people feel comfortable. I really like to talk to people about their bowel movements, and I know that sounds weird, but a lot of times people are really shy about how pooping's hard for them or what happens during that. And so that's something about my personality I think that makes me a good fit for the specialty. My approach to patients is to try to treat the whole patient, not just one problem, to work with all of the providers to understand what all the different aspects in their health, in their life, in their emotional stresses that can be contributing to their problem. I try to ask open-ended questions and kind of create an anything goes kind of atmosphere in my clinic where I just blatantly ask them questions that no one probably ever asked them before. So if I wasn't a physician, I would probably be doing field work, studying plants and animals. I really love being outside. I have tons of houseplants, a garden, chickens. I had 4 dogs at one point, now only down to 2. My dad has a cow-calf operation, so I like being outside working with plants and animals. I left Des Moines for nearly 20 years to do all of my training, and I recently moved back with my husband, who's from Connecticut, and adjusting to life in the middle. I had twins 3 months ago, and so that's a huge change, introducing children into my animal life. So that's about it. I like to run historically. I haven't been running as much since these infants, and I like being outside. So one surprising thing about me is that I'm an ultra marathon runner. I've run multiple 100-mile races through the mountains of Utah. I did this during my residency training. We always say that surgical training is training enough to run these mountain races, and they're some of the darkest times of my life and some of the brightest times, being alone in the mountains at night or with a good friend pacing you.